One last thing I wanted to ask you. Studies have shown that black patients have the best outcomes, specifically men, when they have black doctors. What is at the core of that, do you think? Because you've had these conversations, I'm sure, sitting in the exam room where you are right now that most of us are not privy to. Is it diagnostics? Is it trust? What is it?
Yes, for many individuals, they come from communities where there is a long history of mistrust, where there's these oral histories, these stories, these experiences that people have passed down from generation to generation. And in many cases, that's not good experiences that they're sharing with their loved ones. So people already, for the most part, feel a bit anxious, feel a bit uneasy about going to the doctor, and may have concerns about how they might be valued, how they might be heard or listened to. So that's kind of number one. I think as a physician of color and other physicians of color who work with communities of color as well, we're able to kind of really understand some of the complex dynamics, the interplay between their life and their health. Also understanding in a little bit more depth, what are some of the cultural references? What is the diet like that may contribute to health? What are the values around health? How do people even explain or describe how they're feeling in their bodies? And those are very specific things that, if you're from that particular community, you can kind of understand to a greater depth and detail, because the doctor may have an altruistic connection to the patient and really understand their health in a depth that other providers may not be able to.
Dr. Alisha Liggett, thank you so much for being willing to share your own personal experience and the experience in your practice. Appreciate it.
Thank you so much for having me.